Welcome, Dr. Schechter. We are so excited to have you join us at Unique Adolescent Minds Unlocked. As our listeners know, we dedicated some time bridging the gap between normal teenage distraction and the structural challenges of ADHD. Last session, our psychiatrist, Dr. Du, was fantastic at explaining the core issue, the neurobiology, symptoms of ADHD, and the role of medication. She helped us understand the why the struggles are happening. And if you missed it, please go back and listen. It's essential groundwork. But today we're going to explore the how. Julia, you live and breathe in the world of the how. You make the diagnosis and translate it into a daily battle plan. You teach parents, counselors, and most importantly, our youth about themselves and how to manage the individual roadblocks of executive functioning. How to function in the real world, from the classroom to the dinner table to life transitions and other complex transition. We're hoping to receive the playbook for success. Welcome to the show. I'm thrilled to announce Dr. Schechter, a renowned psychologist specializing in adolescent behavior therapies and executive functioning coaching. She works directly with families, schools, teenagers, and build the real-world skills needed to thrive. She's going to help us understand how to move from the why don't they just try, and how can we set them up for success and wins. So let's dive in. Hello, Julia.
Hello. Thank you so much for having me.
Can you introduce yourself to our audience and our listeners?
Yes, I am Dr. Julia Schechter. I am a licensed clinical psychologist and an associate professor at the Duke ADHD program in the Department of Psychiatry and Behavioral Sciences.
How are you feeling right now?
I'm feeling good. I'm so excited to be here.
I love it. So let's dive in. Let's start. If you're a parent or a counselor who suspects ADHD, you're at the most critical junction, the diagnostic evaluation. Getting it right is everything, because proper diagnosis does not just give you a label, but it gives you a blueprint for how do you manage and how to lead to success and support. So for our parents or school counselors who suspects ADHD, what are the essential components of a thorough and proper diagnostic evaluation for an adolescent?
I love this question. You mentioned the kind of the how, and like this really gets at it. And I think it also gets at the question of like, what are we looking for, right? And so we need an assessment that's really going to help us get down to the crux of what the challenges are. And so, backing up a second, I know Dr. Du explained ADHD, but I always like to do it too in my psychology lens.
Please do.
ADHD, attention deficit hyperactivity disorder, it has to do with regulation, right? It is a challenge of regulation, disorder of regulation, and that regulation can show up in terms of challenges with attention, right? Being able to regulate your attention to the thing you're supposed to be paying attention to. It might be regulation of behavior, being able to recognize, right now I really need to regulate my body and stay calmly in my seat. And it also can be regulation of other things like emotions, and that doesn't always get captured, I think, sometimes in the traditional ADHD, but that certainly is part of it. So what we have to do in an evaluation is figure out, does somebody's level of regulation in these domains of inattention and hyperactive and impulsive behavior, does it differ from what we'd expect in the typical developing child, adolescent, adult? And so to do that, we really need a couple of things. One is we need some standardized ratings, right, to kind of say, okay, does somebody's level really differ from what the norms are, what we'd expect when we look at scores? So one thing that we want to gather are ratings from people who know an adolescent well. Their parents typically, teachers typically, but we also could think more broadly, coaches, other people who just really know this kid. And so rating scales are one essential piece of the evaluation.
Yeah.
Another piece of the evaluation that we have to do is figure out, is there a better explanation for the kinds of challenges that someone might be experiencing? So most typically we're thinking about Could anxiety be explaining some of this? Could depression? Could trauma? Could just, just some regular challenges around transition to a new setting. So we have to do kind of a thorough assessment of their psychological functioning and see if there's some other better explanation beyond ADHD. Another piece that we have to figure out is, have these symptoms or these challenges that someone is experiencing been around for a while, right? They didn't just suddenly spring up when someone started ninth grade, right? So we have to get a good developmental history as well. In addition, so all of those pieces really go together, and we gather them, like I said, through rating scales and also through clinical interviewing, and we kind of put those pieces together and kind of figure out, okay, does this person kind of exhibit more of these symptoms, as well as kind of this last piece that we have to make sure, are these symptoms contributing uniquely to challenges and impairment, right? Do they correspond to actual challenges that someone is experiencing? That's a lot to gather, which is what also makes ADHD challenging to diagnose.
Yeah. And you spoke on it a little bit, so I want to go there. Parents and professionals, it's crucial to understand like ADHD and its core symptoms, and a lot of people miss the emotional ability that's with that. But even 80% of teens sometimes is co-occurring with other mental health conditions, like you talked about, the anxiety and depression. What are the most common co-occurring mental health challenges that you've seen that also appears alongside with ADHD in teenager, and explain further why the screening is so important in that?
Totally. So some of the more common co-occurring conditions that we see in adolescents would be kind of those internalizing disorders like anxiety and depression. What can make it especially complicated to tease that apart from ADHD is sometimes the ADHD symptoms can cause anxiety and depression. You're having trouble turning the stuff in that you've done for school, and wow, you might be really nervous or worried about that, or it might get you really down. So that's a really common co-occurring condition. Learning disabilities are also really common co-occurring conditions. So things that people probably have heard of, like dyslexia or dyscalculia, that are kind of to do with, it's another kind of learning disability. Those are really the most common things. I guess a third one, just to be that comes up pretty commonly, is a pretty significant behavioral disorder called oppositional defiant disorder. This is really where a child is really being especially oppositional, understanding the rules and breaking them anyway. There's a lot of irritability that goes along with it. All of those conditions can be really challenging to tease apart when we're doing an evaluation. But because again, ADHD could be driving some of those, or they could be really occurring alongside those.
Yeah, you gave so many different insights and proper evaluation. It was definitely thorough. If parents are bringing my kid in, they will say, how long is this going to take? How long do they expect for an evaluation?
That's a really great question. And part of the answer is going to depend on where someone goes to get an evaluation. There are different types of providers who can do an ADHD evaluation. Most commonly, you can start with your pediatrician. This is hopefully someone that knows your kid well, knows your family well, known you all for quite some time. Even if that's not the case, if you start with a new pediatrician, still a good place to start. Sometimes the pediatrician is able to do the evaluation I described. So there are kind of briefer rating scales that pediatricians can use, and they can maybe do a briefer sort of semi-structured interview. Sometimes they can't. They might say, you know what, this feels a little too complicated, or I want to make sure that you've got someone who can really dive in more deeply. And then you might go see someone with more psychological training, psychiatric training. So this might be like a psychiatrist or a psychologist, or a social worker or counselor. They would hopefully be able to do kind of a more thorough evaluation and really help to tease apart these potential co-occurring conditions.
I like that because most people see they send a referral, their primary care send a referral to mental health providers and specialists, and their wait list can be sometimes long,
Yes.
up to 6 months or even beyond that.
Totally.
And so it's nice that our listeners can hear that you can actually start with your pediatrician to start the groundwork if you suspect ADHD, and they can do concise scales, probably not as thorough as the mental health providers, but they can start the work to get your teens or children support that they need.
Exactly. And one thing I would mention on that too is that, yes, the wait lists can be really long, but that doesn't mean that a family can't start kind of, getting prepared for the evaluation that might be coming down the pike. So one tangible kind of practical step that parents can take is starting to take their own notes, right? To write down their observations, right? Or gather some extra information from from a kid's coach. An organization called understood.org has some really great free resources for that kind of sort of note taking. So that might be one thing that as families are waiting for the evaluation, they can start to just write down the kinds of things that they're observing for their teen. So when they go to that evaluation, they can say, you know what, these are all of the things that we've observed.
Yeah, make it easier. So listeners, you heard it. Understood.com is where to go to figure that out.
It's actually a .org, but it's a .org. And actually I'll also make another plug. Here at Duke, we actually have a center that is focused specifically on girls and women with ADHD, and that is ADHDgirlsandwomen.org is the website for that. And on there, we actually have one designed for adults. So same kind of note-taking, brainstorming, helping get your thoughts sort of collected before you go to an evaluation. So you can find that free on our website. So if you're kind of thinking about an ADHD evaluation for yourself as an adult, that's something to consider.
I love that. Everyone, .org, okay? .org. We know that there are challenges is real, especially ADHD in children, adolescents, or adults. Sometimes a teen can fall apart more at home than they do at school, or it can be vice versa. The official diagnostic criteria, of course, it takes multiple settings to diagnose ADHD, but yet parents and teachers sometimes see a completely different kid or a different teenager. That is not unusual. What often are symptoms that differ from reported at school versus home? And what are the key warning signs that a parent should watch for? And what are the key behaviors that a teacher or counselor should watch for in the school-based setting?
Yeah, that's another really great question, Bray, because it's true. One of those things that we need to establish in that evaluation is, are these symptoms occurring in different places, which is why we want to get rating scales from multiple people. And we absolutely have data to show that there can be some pretty significant inconsistencies across settings. So what do you do with that? Mm-hmm. So some of the signs you might look for. When you are a parent at home, you really get the behind-the-scenes action, right? So if, for example, there is a big project that's coming up for your adolescent, right, and it's going to take a couple of days or so to prepare, to plan, to execute all of those things, kind of just noticing what is the process that my child takes. Are they waiting to the last minute? Are they pulling a lot of all-nighters, even in high school, to get this stuff done? Like, what is the sort of the ultimate grade might actually be really good. But what are those behind-the-scenes kind of processes that parents are noticing? Keeping in mind that it's not unusual. I mean, all adolescents are figuring this out, right? This is part of middle school, high school is, how do I learn to plan my time? But if you're noticing that your child is just seeming to have a lot more difficulty, really having to lean on parents much, much more than you'd expect for their developmental level, that might be one particular sign. A sign that a teacher might see is if you see a student really zoning out a lot, that might not be necessarily cause for concern. It might not be disrupting your classroom, but that's still concerning. We're hoping kids are really, paying attention and not requiring a lot of teacher redirection, especially as you get into high school. And so if they're seeing that, what I would probably say to a teacher is that would be something I'd want to communicate to a parent. Like, you know what, this is something that I'm noticing for your kid. Do you notice this at home? I think another thing for teachers is that if they're able to communicate it all across the different classes, of course, it's not unusual for certain classes to pique kids' interests more, but are they noticing the same kind of inattention or activity level across different classes? That would be another indicator as a teacher, I think.
I like that one because when most people think of ADHD, they think of the hyperactive kid and not the ones that's actually zoning out. Right. So highlighting that difference that it can present with, I enjoy that. Yeah. ADHD, especially parents and teachers who learn about it really early or maybe have exposure with younger kids, they can know about parent management training. PMT is what it's called. A fantastic protocol at managing behaviors for younger children. But once that child is an adolescent, PMT kind of loses its effectiveness because the teen's focus shifts from pleasing their parents to more of those peer relationships that they have with others and how do they develop their own autonomy. While PMT is common for younger kids, what specific type of behavioral or cognitive behavioral therapies are most effective for our adolescent population?
When we're thinking about adolescents, we're usually thinking a little bit more about organizational skills training. So helping the adolescent themselves learn to manage their time, kind of being able to look at a calendar or look at their planner and say, okay, I've got this much stuff to do. How do I fit it in with, because I know I have soccer practice and I know I want to go see my friends, and how do I plan all of that? Starting themselves to notice, okay, what are my major distractions? How do I identify them? How do I put them aside when I need to? How to know when to ask for help from parents and teachers or friends. Those are the kinds of things that we typically think about for this age. Though I would make one small plug. Also, you mentioned PMT, parent management training, is more for younger kids, and you're totally right. The principles, though, can definitely extend across time. So maybe you're right. Your 16-year-old might not necessarily be looking for that praise quite as much, although, who knows, they still may. But they probably are looking for access to the car keys, or they're wanting some extra time on their screens or whatever that might be. And, that's natural, right? And how do we sort of leverage that, right? And say, hey, I hear you want that. And, as your parent, I'm willing to work with you on that. But these are the kinds of things I need you to do. I need you to, really, pull out your planner and start to work on your stuff. And how do we scaffold that a little bit? I think that's another thing when we think about ADHD is we probably do want parents to be involved. And when we think about those behavioral interventions, we usually have parents involved to some degree because we want them to also be rewarding or reinforcing that effort. So yes, you can have additional time on your screen, but I need to see you have put some effort into planning for this project that's coming up in the next couple of weeks.
I like that, leveraging what they idealize as praise at this moment in their time versus when they were younger.
Exactly. What's going to be meaningful for them at that developmental stage.
We talk a lot about the core symptoms of ADHD, the inattention, the hyperactivity, sometimes even the zoning out, which is related to the inattention. But a lot of people don't focus on that core self-esteem and low self-esteem, the anxiety, the oppositional behavior, defiance that you talked about. What are therapeutic interventions that could be tailored towards that? Yeah,
I'm really glad you asked this question. So, yes, I mean, definitely. These symptoms, they can take a toll, right? And I mentioned earlier, I mean, it could be, self-esteem issues or mood challenges develop secondary to ADHD, or they could be alongside. And going back to that the behavioral intervention that I just mentioned, the way I described it was very practical skills, which are important. However, another piece to that intervention, especially as you get a little bit older into high school, is weaving in the cognitive piece of that. And so what I mean by that are, what are the thoughts that come up when, oh, wow, I've yet again forgotten to turn in my homework. Mm-hmm. Even at this age, kids are developing, right, those thoughts of, oh, I must just be a bad student. Yeah. I must just be I'm so forgetful. I'm dumb. I'm too emotional. I'm too much. These are all the kinds of things that we hear about at the clinic. And how do we start to notice those and help kids reframe them of, what, I have ADHD. It does make it harder for me to do some of this stuff. It doesn't mean I'm a bad person. It doesn't mean that I can't accomplish incredible things. It means that I might need a little bit of extra support in this area. Right. And that's okay. So those are the kinds of things that you'd want to start to probably weave in to the behavioral interventions.
Yeah. So we talked a lot about the organization skills and the emotional regulation. what are one or two most critical life skills or coping strategies that you as a psychologist work with adolescents with ADHD on?
So one of the kind of critical, I'd say, coping skills is just like knowing yourself, is just understanding that this is a part of you. It's not all of you, right? And starting to figure out like what is the ADHD part of you and what does it look like? One of the things I think you've talked about in your podcast is ADHD can look really different for so many different people. And so for teens to kind of say, okay, well, this is how my ADHD impacts me right now, I think is really important, because that allows kids to know what are the resources that are going to be most effective for them. Where do they potentially need to ask for help versus when do they got this? What do they need to advocate for when they're at school? So I think that's the first piece, of just like kind of knowing yourself and knowing, okay, this is how ADHD is impacting me now. I think a related piece to that too is being able to recognize that ADHD does not mean you are broken or your brain is bad or something is wrong with you. It just means your brain is developing in this slightly different way. And there are so many amazing things that can come along with thinking in a different way. In fact, we at the Duke Center for Girls and Women with ADHD, we talk. Our tagline is "Thinking differently about different thinkers," and certainly we talk a lot about girls and women with ADHD, but this does not apply to any particular, sex or gender. Everyone with ADHD thinks in this very different way usually, and it can be a gift, right? To be able to be the person in the room who can add something that no one else sees. So that's my first piece, is how to kind of recognize, how does ADHD impact you? And I think the second thing is again, related of just, being willing and open to receiving resources and knowing that if you receive resources, that just helps you meet your potential and all of the amazing things that you can do to thrive. I think sometimes people view, getting accommodations or treatment for ADHD as is that they don't deserve it. And that's not the case. I know your listeners can't see, but I'm wearing glasses, right? That's the way my eyes have developed. I need glasses. Someone with ADHD might need medication at certain points or treatment at certain points to help their brain function in the way, or help them meet the expectations of the environment that they just happen to be living in. And there's nothing wrong with that, and being open to receiving the treatments that you need at the certain times that you need it is my second piece of advice.
I love that. I love that a lot. And I love the way you're talking about like using it as your benefit or your gift instead of something that's detrimental to you. I think Dr. Du said it yesterday, and I've never put it in that framework, where if we were out in the jungle and the ADHD or the kid with ADHD saw the lion or saw the wolf coming to attack, they would be the ones that's not getting eaten because all the other kids are focusing on what the teacher is teaching at that time. So they will have an adequate enough time to get away. But then it doesn't work in the real world of a classroom setting. You don't need to be on guard. You need to be more focused on how to make you successful. So I love just that analogy that she created. Like, it's helpful in certain situations. Yeah. And then you need to learn how to reel it in or bring it back a little bit when it's not helpful in that environment.
Exactly. And just right now, adolescents, people, their job is to go to school. Their job is to pay attention all day and to sit in the chair and to then go home and do more homework and plan. And that is their job. But that's not their job forever. Right. And I think that's another piece to talk to teens about is, look, here's what you're expected to do right now. But there's a lot of life left, and you could end up as an ER doctor where you never know what's coming in the door, right? And that is, it's just one kind of exciting challenge after the next. Or maybe you end up as a journalist who travels all over the world and gets to interview new people. And so I think that's, I guess, another thing, just another kind of core tip for an adolescent of this, what you might be experiencing right now that is not your forever. And your ADHD brain is probably going to open up a lot of doors in the future. That said, we also know that, right now you probably do have some obstacles, and how do we help support you with those obstacles now?
Yeah, absolutely. So you can use it to your advantage in the future. Just buckle down right now and get to the next step.
Right.